Mark, thanks. March is known as Self-Harm Awareness Month, and on average, more than 2 million people in the U.S. intentionally self-harm every year. Frontier Health has several resources for you or someone you know in crisis, and here to tell us a little bit more about the topic is Dr. Tim Perry. Thanks so much for being here today.
Absolutely.
Well, first off, what is self-harm?
Well, it can be anything from, it's a deliberate and intentional injury of an individual. It can be anything from scratching at your skin to pulling your hair, all the way up to more serious like cutting, abrasions, swallowing poison, burning yourself. It can be very serious behaviors.
So why is it that people turn to this?
It's usually a maladaptive coping strategy. It starts with an internal pain, usually something that they haven't addressed or coped with, and it's bringing it to the surface, bringing it to the outside. They've come to cope with this internal pain in this physical manner so that they can actually see and feel the pain that's internal, that's not being addressed. So it's internal pain brought to the surface.
And I know you mentioned some of the things that people do when it comes to self-harm, but what are some signs that people can look out for in others?
Well, if you notice someone that's wearing inappropriate clothing for the weather, like long sleeves or jackets during the time that it should be warmer weather, if you notice blood stains on clothing, if you're seeing somebody that's actually trying to distance themselves from you getting too close to observe something about them, if you're a parent and you notice that your child's keeping sharp objects in their room, or they're wanting to isolate from you, or they're not wanting to talk about what's going on with them a lot, those are some signs to kind of explore and see maybe there is something going on with this kind of behavior.
And how can folks get help? I know that it's really hard to kind of reach out because there's almost this physical and this mental aspect of this.
You know, it's one of the most challenging things to actually address is intentional self-harm. The first and most important thing to know is for telling somebody you're not alone. There are help available. It's that internal pain that's causing the behavior, and until that gets addressed, the behavior will continue. So reach out and talk to someone. To a trusted friend, a professional, really needs to help guide you into that course of treatment.
Well, Dr. Perry, thank you so much for coming on today. Great information and advice as always. And for more information about self-harm awareness and plenty of other topics, you can contact Frontier Health. That email and their phone number is right there on your screen.